I want to talk about the acetabular labrum of the hip joint. And here we're trying to look at the tears. Okay, so you could tear in the front, that's the anterior. You could tear in the back, that's the posterior. Okay, so let's quickly look at how all of them could actually present. So for the hip, or known as the acetabular labrum tears, you could see, okay, labral tears. That's how it, So it just simply involves damage to the acetabular labrum. That's the cartilage ring, around the hip socket. So you can have the anterior ones most of the times. Then the posterior ones could also occur. So let's talk about them. For the acetabular labrum, let's have a review of its anatomy. So it's a fibrocartilaginous ring. It's around the acetabulum. Now it deepens the socket and it stabilizes the femoral head, distributes load and maintains joint lubrication. So if there's any tear there, it means the labrum is damaged, it's frayed or detached, often leading to pain, reduced hip stability. So types of the labral tears. Anterior just simply means it's occurring in the front, So there's a lot of pain, clicking, locking, catching sensation, and the pain worsens when you flex. Okay, that's when you try to use the front. So it could be due to femoral acetabular impingement. It could be due to all those repetitive sports that you have to now be, moving your legs. The congenital hip dysplasia. Then for the posterior one, is occurring at the back. Okay, so this one is more of like pain in the buttocks, pain with extension when you're trying to move your leg to the back. Okay, sometimes associated with instability. So it could be due to hip dislocation or subluxation, repetitive, spots around that side, traumatic injuries. So you diagnose it using the Fadir test or the Faber test. Okay. Then on imaging, you use all those MRI, arthrogram, then also X-rays. Okay. Then try to do your differential diagnosis there. So you manage it by the person resting, NSAIDs, also disease, physical therapy rather. There is corticosteroids, arthroscopic surgery just to repair or debride any dead tissues there.